It might not be that the provider doesn't care, but we just don't quite know how to respond. Like we're not quite taught how to do that in
Mhm.
school.
Right.
Um,
Right.
and so I think for me, it's the goal of my practice and being trauma informed and culturally inclusive means that I am offering that safe space for patients to explore and unpack at their own pace,
Mm.
obviously with prompting and encouragement and support from my end, but um, also working with therapists, ideally, to be able to address some of these traumas or adverse experiences, um, and folks with eating disorders or disorder eating, in a more effective way from a nutrition perspective, but also from a mental health perspective by the therapist. And
Okay. Hello, everyone, and welcome to RDs Thriving in Private Practice, where we share our collective wisdom about building a nutrition practice and get inspired. Joining me today is Yi Min Teo. Yi Min is the owner of Yi Min Teo Nutrition, a California-based virtual practice specializing in culturally inclusive, trauma-informed nutrition counseling for individuals with IBD, IBS, and other gastrointestinal conditions. With a deep understanding of the challenges faced by those managing chronic digestive illnesses, Yi Min helps clients to reconnect with their bodies and nourish their relationship with food, all while embracing their cultural identities. Having worked extensively with complex long-term medical conditions in hospital settings, Yi Min recognized a critical gap in nutrition guidance for IBD patients. Many expressed confusion and frustration, often left with the vague reassurance that diet does not matter in managing their conditions. Determined to change this narrative, Yi Min is passionate about demonstrating that nutrition can significantly impact health outcomes and symptom management. Yi Min's approach is centered on personalized, evidence-based care that respects the individual's cultural background. She believes that nutrition should not be a privilege but a necessity, especially for communities of color. With a commitment to accessible, trauma informed care, Yi Min provides one on one support tailored to help clients navigate their unique dietary needs during flare ups, remission, and beyond. Welcome, Yi Min. Thank you so much for being here.
thank you, Catherine, for having me.
Yeah. So let's get into it. What has your journey been like as a dietitian that led you to this specialty and the populations you serve?
Yeah. So I've been a dietitian for about 7 years now, and I didn't start off wanting to do GI or really knowing much about GI nutrition. So a lot of it I've learned in my inpatient work. So I've been an inpatient dietitian this whole time, in different hospitals and different settings, with different demographics, I should say. And I think when I first started my dietitian journey, my goal was to learn how to work with individuals from different backgrounds, different socioeconomic status, from different cultures as well. And so cultural nutrition has always been near and dear to my heart. I'm Singaporean. I grew up in Singapore, and I grew up in Chinese culture. And in Singapore, we have a lot, it's pretty much like a melting pot of different cultures. And so that's the environment that I grew up in, that I'm aware of, and am always interested in learning more about other cultures too. And being in nutrition and during my time as an inpatient dietitian, I realized that very often with my conversations with patients, the challenge is always, well, all these dietary recommendations in the nutrition care manual or whatever that's available out there is just not culturally relevant. It doesn't have my cultural foods. Then what do I eat? Does that mean that I just can't have what I enjoy? And so for me, that was the first kind of thought of like, oh, I that's where I'm passionate about and I can help fill the gap as a dietitian. And over time, as I started covering different services within a hospital, and I came across the GI service and saw multiple different GI conditions, some really rare, some really common, your gastroparesis, your reflux, all the way to mast cell activation syndrome, Ehlers-Danlos syndrome patients, um, patients with GI surgeries and ostomies, and IBD. And so from there, I realized that, wow, the GI field is so ever-changing, guidelines are ever evolving, but we really don't have much on, nutrition, and I want to learn more about it. So through patient stories that they've shared with me, a lot of it being, you know, there is this existing gap of, patients being told that diet doesn't matter, they can just be on medications. And for me, that's like, it's literally the gut. That's how we digest and absorb food. Like, how can diet not matter? And so I kind of went down this rabbit hole and an exploration for myself, and for my patients too. And I realized this is it. This is the specialty that I can really enjoy in the long run, and I can help contribute in that way. So patients were asking in the hospital, they were like, "Oh, do you take clients outside of the hospital?" And at that point, I wasn't really thinking about that. But when more people started asking, I was like, "Oh, maybe there's something there." So that's kind of my journey and what prompted my thought on starting a private practice.
Nice, nice. So I have so many questions about your approach to working with diverse populations, and with GI care and all of these things, and the trauma-informed approach that you use. But first, let's talk about nuts and bolts of your practice. And so what you just said is that the seed was planted by some of your existing patients who thought that they might need some ongoing support. Do I have that correct?
Yeah, and I mean, a lot of GI conditions are chronic and complex, and it's not just the GI condition itself, but when you have diabetes, kidney disease, that's tied into another comorbidities too. One common, not complaint, but just frustration that I hear from patients is that it's hard for them to find providers and dietitians who specialize in tackling all their different diagnoses,
Mm.
right? So you would have a dietitian who specializes in diabetes, someone who specializes in GI or kidney disease, but what if you need someone who can cover all the different bases? And so for me, when I first started in my journey, I learned all of the different disease conditions, and I am proficient in them. That was my goal as like a baby dietitian, was that I want to be good and proficient at what I do, and then I can start specializing. So that was my thought process. And at that point, when I started hearing some of these, um, wishes that patients have, I was like, oh yeah, I could position myself in that way of, being able to come up with a personalized nutrition plan for these GI patients who also have complex other medical conditions or history. Yeah.
Nice. Nice. Yeah, that is, I think even when we're, like you said, baby dietitians, we learn one thing, then another thing, and another thing, but we don't necessarily know how to put all those pieces together. So it sounds like with all of the experience working in critical and acute care settings, you've been able to kind of figure that out and then take it into the outpatient setting.
Yeah, and I think a lot of it were prompted by patient questions and also just a lot of research on my own of, okay, well, can I take this specific, say, the small particle size diet for IBD, for gastroparesis or other conditions, and what are the commonalities and differences with consistent carbohydrate diet, with low potassium, low phosphorus diet, and kind of really putting that together. But
Mhm.
I realized that just it's so nuanced and personalized for everybody. So
Mhm.
that's also the beauty of it. It's hard. I think it's time consuming, but it's really rewarding when it
Yeah.
works for the patients.
Yeah, that's a good, I was trying to think of um, fun isn't quite the word. I think rewarding, right? Keeping it interesting. Yeah, it keeps it interesting. Time consuming, rewarding, and it will keep your interest peaked. You're not going to get bored, right?
Exactly.
You're not
Yes.
going to get bored for sure. Yeah. So tell me a little bit about how you got started. Was it like I'm going all in, or was it like a couple clients at a time and then went all in? Um, How did that scaling of your practice work for you?
Yeah. So I started it when after I left my full-time inpatient job with the goal of opening my practice, because I realized with working full-time hours, this is really hard for me to dedicate the mental space and time to start growing the practice. Not saying that's impossible, but I think at that phase in my life, I was like, okay, I don't have kids. I don't have a lot of obligations or responsibilities, and I'm able to have a little bit more flexibility, maybe more so than others, with jobs and working hours and stuff like that. So I went per diem and still doing inpatient work because that to me, it's, after doing it for a while, it's pretty comfortable.
Mhm.
I still get to keep my skills in use in the inpatient setting while I learn to grow and navigate my private practice. So I started off with a few clients who found me on social media when I just posted on my social media and say, hey, I started my own private practice, and I'm specializing in GI. And so I had people reach out, and I was also mentioning it to, obviously not in the hospital that I work for, but in others, other connections, other doctors that I used to work with, other dietitian friends, telling them that, hey, I've started a practice, will love to help support, you know, any patients that you think might need help in outpatient setting. So it took a while because I just wanted to give it time. I wanted to put my 100% with every single client. And I got this advice from another dietitian who started her practice, years before I did. And she mentioned like the first 2 years are usually like the slow, like it's a slow burn, and it
Mhm.
just takes time for you to accumulate experience, connections, and just learning how private practice works. And so I kind of adjusted my expectation a little bit because I think at that time a lot of information on social media was, you know, quit your full time job and you can earn 100K a year with private practice, with coaching. And for me, it just didn't quite align because I had to ask myself at that point of like, why am I starting a practice? Am I in it to make money? Yes, I want to pay my bills, but at the same time, my goal has always been, and it still is, to be able to provide access to GI nutrition care, especially for Crohn's and colitis, because I got that specialized training too, to individuals from different cultural backgrounds and
Mhm.
ideally in different socioeconomic status too. So
Mhm.
I don't want cash pay to be a barrier necessarily for patients, but I started out with cash pay because I'm trying to learn just how the environment works. It's just very different. So
Right. Right.
yeah.
So when you say you started with cash pay, does that mean you still only do cash pay?
So right now, I actually just got into network with Aetna and Blue Shield,
Okay.
and you know, I gave myself time to really just learn about it. I'm in different Facebook groups, seeing other dietitians' experience on it, billing, like that's a whole other beast. But yeah, so I'm dabbling into still doing cash pay, because that allows patients and myself honestly to have more flexibility and
Mhm.
less admin baggage.
Mhm.
But for me, I realize in order to make sure that I reach the patients that truly need my services, having insurance is a good way to go too.
Yeah.
So yeah.
Yeah. And in for Crohn's and colitis, are is that typically a guaranteed reimbursement as far as with Blue Cross Blue Shield, or is it sort of, is it dependent on other factors?
Yeah, I think I've seen a mix. So I recently just started transitioning some of my folks to insurance and starting to bill as an in-network provider. So we'll see what happens with that. It's very, very fresh. I just got credentialed like a week ago.
Oh, okay.
So yeah. But as far as like coverage, it is pretty limited depending on the plans that they're on. So that part I'm learning it myself too, and
Mhm.
it's a whole process. And I think for me, it's meeting where the patient's at and making sure they're getting safe nutrition care. There's a lot of
Mhm.
gray areas and mixed messaging out in the gut health world. And
Mhm.
I think like for IBD patients, especially because it's a inflammatory condition, um, I want to make sure that there is a safe space to explore, diet therapies, to have evidence-based support versus just, you know, supplements and like guarantees to cure the disease and stuff like that. Just very extreme messaging. So
Right. So what is the typical client journey? And so I'm speaking of, do they typically, they might find you because they've worked with you before in the hospital, or might be word of mouth, or maybe they're referred by another provider. So that's point one. And then they reach out and that you bring them on board. And then how many sessions do they usually stay? What's the frequency of the session? What does that whole experience with the client look like?
yeah, so I think it's very different for each individual. I don't know how other practices do it, but I usually tell patients that nutrition takes time and I can't guarantee you results in one session. I mean, that would be amazing. And please, put all of us out of a job if nutrition is so magical, but it just takes it takes time. It's finding strategies and tools that work for, that person. And I'm here as, as support and as someone to guide and hopefully shorten that process of, you know, of that struggle that patients might go through. And so typically folks are with me for at least 3 to 4 months,
Mhm.
and a lot of my folks stay on for longer because they're, again, there's a lot of chronic, it's more of a chronic situation where you have ebbs and flows of, you're thriving one day and sometimes you're in a different environment or different phase in your life where your disease might flare up,
Mhm.
or certain therapies might not be working as well anymore, and we need to reevaluate where things are at. And so um, I would say 80% of my patients stay on with me, and there are like some one-off consults where they're getting a not second opinion, but like, they've seen multiple GI doctors and or other dietitians and they're still struggling with their symptoms. And so they will come and see me for like a couple sessions. And some feel okay and they have enough tools to be on their way, and some continue to stay on. So I would say it's really varied across the board. And again, that is kind of GI in a nutshell, I think, which I really enjoy. So.
Yeah. So let's get some insight as to how you work with different populations, different communities, socioeconomic backgrounds. Like, what are some of the difficulties that we might not be aware of if that's not our typical population?
Yeah, I think like specifically with GI, there's a very large variance with, when it comes to affordability and financial ability to pay. And I'm sure that's the case for a lot of other, conditions as well, and especially with how the economy is right now. Just I think being cognizant of the big picture, and I think it's okay to also ask potential clients or current clients of, what are some of the struggles? It's fine if they're okay with talking about it. I talk about finances also with my clients, making sure we're tailoring nutrition strategies that make sense based on their financial abilities as well. And so before I started taking insurance, I was offering sliding scale and just making sure that, you know, patients' needs are getting addressed.
Mhm.
And I'm still able to pay my bills, which is awesome. But just having that flexibility, I think that's really nice. So.
Yeah. And so then how does that all start to translate into the let's say you're working with someone with a Chinese background and you want to be culturally relevant for their food choices. Give us an example of how some of the recommendations for IBD might work.
Yeah, I think with IBD, it's really nice that there's a lot more awareness and resources, especially the past 2 to 3 years of diet therapy guidelines, some of the new research that's coming out, and diet trials and things like that. And so, really. I think for any GI dietitian, just looking at the guidelines and not necessarily following it to a T, because every patient is just so different, but personalizing that recommendation. So I think I usually have a pretty open conversation with patients of, how important is diet in your perspective when it comes to like your disease. How would you like to utilize diet for to manage your disease? In what sense and in what ways? Some patients might be interested more so using supplements or herbs versus diet therapy itself. Maybe there's a middle ground too. So I feel like that's very different, regardless of whichever culture that person is from. And talking about, I think with IBD specifically, with diet therapies, there's specific monitoring parameters, and not just putting someone on a diet and say, okay, here's the Crohn's disease exclusion diet. Here you go. Here's a hand-on buy. It's more so how long are we doing this? What changes are we making? What are we monitoring and looking out for? Is your provider aware about it? And I think that's one aspect that I love. It's kind of is that joint discussion and collaborative decision making, and empowering patients to make their own decisions in that way. But I'm here to relieve that burden with them and be their cheerleader. And so I don't know if that fully answers the question. I just started kind of getting excited talking about it. But yeah, I think, with the culture aspect, I don't just leverage from my own personal experience, but asking them questions. If someone's from a different culture, I often say, "Oh, what are some of the common practices that's more that you're currently practicing in terms of like diet, in terms of religious practices that takes time and priority in your day? What does that look like? Do we need to modify nutrition around it, or is there a way to find a middle ground?" And so for Chinese patients, it's pretty straight. I wouldn't say it's pretty straightforward, but it's easier to connect in that way. And there's fewer words needed because I get them and they get me. And I think that's the benefit of having someone similar to your culture as, as your provider, but it might not work for everyone. It's, again, finding someone that you feel safe and comfortable and you can trust to help support you in your health journey. It could be me, it could be someone else, but I think that's always like the most important part, that you feel safe sharing and being vulnerable. And I think that is where like the magic happens, where as a provider, I then get to see and be aware of what you're struggling with and come in to help you in a way that works for you. So yeah, I think when it comes to personalizing diet recommendations based on anyone's diet, I'm doing a lot of research too, but I also ask the patients or clients, what are some of the resources that I can go explore myself, and I would love for it to be like a discussion. So it's always a learning process.
Yeah, I feel like you are like answering all of my questions before I have a chance to ask them, which is great. No, this is great. So, because just to sort of summarize what I'm hearing from you is you're asking a lot of questions, right? You are doing a lot of empathetic listening, right? And sure, it helps if we have experience with a specific culture, similar to the one that our patient is from. But what is equally important, I'm hearing you say, is that trust and that listening, that openness, that willingness to learn. And if I don't know the answer, let me see where I can find out, and give me resources, point me in the direction where I can find out. And it probably also helps to be dietitians that have a broad understanding of food and nutrient composition, so that we can then translate those recommendations from the doctor or the diet to make the food choices really work for them in whatever capacity they need to. And I love what you said about how important is managing this with food and diet, right? So some people, they take their eating life really, really seriously, and other people is like, I don't know, just, I'll follow the diet. Just give me the diet, right? That's a little more rare, but I'm sure it happens.
Yeah.
Yeah.
And just meeting people where they're at. Some people, I had a client who just told me like, I'm working with you at the perfect timing in my life. Like if I've met you earlier or later, maybe it wouldn't work out very well and it's not related to anything, but more so like when she's ready for that. So
Mhm.
I think client readiness to change is a huge thing. And I'm sure like we see that in when we talk with clients, or like, I mean, if someone has worked in the inpatient setting, we see clients when they're not quite ready for that information too, because they're just, they're not in their best state to talk about it, or they're newly diagnosed. And so I think that's a very important skill to, you know, to equip yourself with as a dietitian to best support the patients. So
100%. Yes, yes. So let's talk about trauma-informed care. This is sort of like a buzzword, buzz phrase that I think a lot of folks don't really quite know what it means. What does trauma-informed care mean for you?
I think it's coming back to the same similar concept in cultural inclusivity as well, where um, we are recognizing and responding to the information that they're able to share, or maybe like when they're reserved. I think a lot of it's also the body language when it comes to, say, whenever I'm asking a patient like how their relationship with food is, and having them just get kind of offering them that sandbox to spend time in it and explore it and unpack it. And I think when when the patient's trying to share more about their experience, and there is some patients might experience more trauma related to food, or trauma related to their family environment growing up, relationship with others, or other stressors or adverse experience in their life. I think for me as a provider, being able to notice that, pick that up is part one, but part two is knowing how to respond to it in a safe way for the patients, and not necessarily just dismissing it. And I think that very often happens in maybe doctor's visits, or maybe not just doctor's visit, but like visits with different providers, is that it might not be that the provider doesn't care, but we just don't quite know how to respond. Like we're not quite taught how to do that in
Mhm.
school.
Right,
Um,
right.
and so I think for me, it's the goal of my practice, and being trauma informed and culturally inclusive means that I am offering that safe space for patients to explore and unpack at their own pace,
Mm,
obviously with prompting and encouragement and support from my end, but um, also working with therapists, ideally, to be able to address some of these traumas or adverse experiences, um, and folks with eating disorders or disorder eating, in a more effective way from a nutrition perspective, but also from a mental health perspective by the therapist. And very often I collaborate a lot with the therapist too on that. We would actually talk over the phone and say, oh, how has your visit been with your patient? Obviously, with the patient's like consent, of course, to see how we can better collaborate and align and our messaging, or if there's something that I can learn and do better on my side to kind of complement what the therapist is doing, and vice versa. I think that also kind of helps to better the care in,
mhm.
in this space.
That's awesome. Yeah, that collaboration is so, so important. I think it gets overlooked when we get bogged down and we're just so overwhelmed. Yeah. The Are there specific techniques that you use to create safety in your sessions?
That's a good question. I feel like that is very different for each individual, but the commonality is sometimes not rushing into topics that I want to discuss. Like I think from a dietitian's perspective, when we hear certain things, we in the GI space we say, "Oh, food intolerance. Oh my gosh, like poor appetite and like weight changes." I want to make sure we hit making sure they're getting nourished and all that. But I think also allowing that patient, also checking in with patients to say, "What are your goals? What is
Mhm,
important to you? What do you want to work on? How can I support you?" And
mhm,
I think just keeping things open-ended, like open-ended questions for
mhm,
patients. I think very often that actually allows folks to share more, and not we're not pigeonholing folks into a certain like topic or direction, I would say.
Mhm.
So
Mhm.
I find that that has been most helpful. And one thing I also learned in private practice that's a little different than inpatient is just a bit of a silence in sessions,
Yeah.
like pauses for people to just like it's okay for them to just reflect and think about what we just talked about, um, versus needing to fill the empty spaces or like the quietness with more things, and
Mhm.
that usually overwhelms patients. That's what I realized. So
Yes, yes. Great, great examples. Setting aside our own agenda for the client, creating space for them to actually think, right? Making sure that we're asking what's important to them. And, I think one of the things, particularly with being a dietitian as opposed to being a psychotherapist, let's say, as an example, is with psychotherapy, sort of expect that it's going to be this ongoing relationship that could be weeks to months to years. Right. But I think as dietitians, and I know I've had this experience before, I'm so worried about making sure that they get value from this particular session that I want to pack it all in sometimes. And to be able to stop ourselves and be like, no, this really is something that needs to be an ongoing relationship, little by little. Going back to the basic tenets of motivational interviewing and just understanding how, letting the client take the lead in sessions more often, right, really does lead to better outcomes in a longer term relationship than, them getting to that place of overwhelm and not feeling safe, right? That's not trauma informed, right?
yeah, yeah, and
Yeah.
I think the overload of information sometimes is trauma itself for some individuals,
Mhm.
and yeah, I totally agree with you with just the need feeling like there's a need to just pack everything in. Some people
Mhm.
like it, but I think very often, like, I also have to remind clients and patients that it is a longer term, relationship that we are working on too. And um, I'm I'm sure you probably have similar experiences as well, but I find that nutrition sessions sometimes is often kind of like we're talking about nutrition, but also it's therapeutic at the same time. It's like medical nutrition therapy. It really does go together. So
Mhm. Yep. Yes. Thank you for reminding all of us of that. Yeah, it has to be. And so I've said this before, we're not just doing nutrition education. We are working with a client or patient on helping them translate whatever guidelines or recommendations will work for their own particular situation and own lives.
yeah,
Yeah. And that,
absolutely.
and maybe behavior change as well, right? So it's a very, very, as you say, therapeutic way of working. Yeah. So we're getting to the end of our time together. I'm curious, um, couple things. First of all, along with trauma informed care, where would you recommend someone that was interested in learning more about that? Where might a dietitian go to learn more about trauma informed care?
For me, I started off and currently still is exploring GI and eating disorder. I think there's a lot of good information from EDRD Pro,
Mhm.
looking at creating safe spaces while also addressing GI issues. That I've just been like in that space and learning as much as I can. I honestly am not super familiar with any other resources. So if anyone else has recommendations, or if you do too, please share it with me. Love to learn more too. A lot of the work and exploration on my end has mainly been on the cultural inclusivity side of things, and just learning how much there is in commonality, as I'm learning and deepening my skills in trauma informed care as well.
Mhm.
So
Nice,
yeah.
nice. Yeah. And so getting back to, just sort of some nuts and bolts of your own practice, I was really impressed with your messaging on your website.
Oh,
Um,
thank you.
yeah, I felt like it conveyed what you do so well, and the language that you used was um, it reflected the inclusive, trauma-informed, sort of kind, compassionate care that clearly you say that you deliver, right? So I'm curious, did you do that all on your own? Did you have help? How did you kind of end up with, okay, here's my website, this is it?
A lot of the learning was actually on my own. It's not really ever like a focus, I would say, on the inpatient side, really, because your goal is just to, I mean, I've been trained in like critical care and nutrition support. I love that side of stuff, but when it comes to when I started to look into doing my own private practice and noticing, like thinking about ways of how can I help support patients to really um, lead them to making effective changes for themselves. I had to learn a lot of the stuff on motivational interviewing on my own, a lot of continuing education, whatever resources that I can find on Google. Google is my best friend. A lot of the CEU websites, Dietitian Central being one of them. There's quite a few. I mean, back during inpatient days, some of it was coming from like the big, oral supplement companies, Abbott, Nestle, and stuff like that. Dietitian Connection is a great area. So I was just trying to find CEUs that's related to the topic, listening through it, and just thinking about how can I apply this into my practice, to just, even if it's asking open-ended questions. That's one thing that I feel like right now, even though I've learned that in my internship, I still have to almost remind myself all the time, like, make sure you're asking open-ended questions, and allowing patients that space to like discuss about it. So yeah, a lot of it was CEUs, and I mean, I'm thinking about like the GI aspect too. Um, I did the IBD apprenticeship program at Cedars
Mm.
for like to really learn more about the disease process and management, and just finding courses like Monash University's low FODMAP diet course for dietitians, and other CEUs from other dietitians too. So I think just kind of taking little bits and pieces, also books from written by dietitians,
Mhm.
um, Evelyn Tribble and her book,
Mhm.
amazing. A lot of the GI dietitians book, Kate Scarlatta, uh,
Mhm.
Tamara Fruman, a lot of their work in GI nutrition, also touching on the mental health aspect. And I think just over time accumulating those information and seeing how it pans out with my clients too, that
Mhm.
just kind of adds stuff together. I don't know if that was a very long-winded answer, but it's just little bits along the way instead of expecting to learn all that I need to know in like one course or like one book. It
Right.
really takes time. Yeah.
Right. We really do need to piece it together, so to speak, and then we're applying it, but how can I say this in a way where it's like we're building our own clinical expertise and our own clinical judgment, not
Yes.
because we're just trying stuff out, but based on what we've learned, we're just seeing how that works with our own approach and our own client population. Maybe that's a way of saying it. Yeah.
Yeah. And I just remembered one more thing that I rely on a lot: PubMed.
Oh, yeah. Mhm.
um, a lot of research. I especially love interviews and case studies.
Mhm.
A lot of qualitative studies, not just the data of like how many percent of patients have improvement with these diet interventions. It's more so the storytelling aspect of the experiences patients share and the research, like subsequent trials and research that has come out of that, especially in the GI psychology space. I think
Mhm.
a lot of those things, as they are having more data to back it up, and it's not just anecdotal experience between me and my client. I think when we start seeing that show up in research, it gives us more confidence to also share with other providers,
Mhm.
and say, it's like the mind, the brain, gut brain axis, and nutrition, they all play together, and it's important to involve a dietitian in this regard too. So
Awesome. Awesome. Well, I think you've certainly done an excellent job selling GI to our dietitian community. And what a specialty. Yeah, it's got so much. I think there's never going to be a dull moment. And we're just learning more and more about the management of these conditions every year. So,
Yeah.
okay. Well, I want to thank you so much for joining me today and telling us everything that you know. I think you have a really lovely, unique specialty, and it sounds like you've got a lot of passion and dedication to it. So, yeah, best of luck with your practice as it
Thank
continues to
you.
grow. Yeah.
Yeah.
Yeah. So thank you, Yi Min, and everyone who may be watching now or will be watching the replay. And we will see you next time.
Thank
Bye-bye.
you.